Today's topic is cough, diagnosis of upper body diseases, respiratory tract infections, pharyngitis, tonsillitis, laryngitis, etc., and their prevention. Here you can see the anatomy of the respiratory system. It is something that we should remember always. Features of the respiratory system in children. They are large head, a small lower jaw, short neck. The mouth and nose are relatively smaller and more prone to obstruction. The tongue is relatively large than that of adults and children, located posteriorly. High location of the laryngeal entrance. The trachea in children is already 3 times softer, more mobile, and easier to obstruct due to edema. Presence of tonsils, adenoids. Reduced respiratory reserve, increased need for oxygen, increased risk of developing DN. Respiratory system. The nasal cavity of the child is narrower. The bottom of the tongue is in contact with the back wall of the pharynx for a greater length than an adult. The nasal mucosa is well vascularized, thin, and has no developed cavernous tissues, so nosebleeds are rare in infants. Respiratory system. The most narrow place is the trachea in the area of cricoid cartilage. A 1 millimeter thickening of the mucosa in this area reduced the lumen of the DP by 75% in newborns and by 20% in older children. Here you can see it in details. Mucociliary transport, removal of mucus, normal functioning of the tracheobronchial epithelium, which determines the state of clearance. Inflammation, violation of the function, flickering light, change rheological properties, sputum production, reduced mucociliary transport activity, and it results to cough. What is a cough? A complex defensive reflex aimed at removing from the respiratory tract foreign substances and pathologically altered mucus. Formation of the cough reflex. Arousal of cough receptors, cough center, and you can see it in the diagram. The main causes of cough: respiratory diseases, upper and lower respiratory tract infections, bronchial asthma, foreign body aspiration, chronic diseases, and cystic fibrosis, and other. Clinical characteristics of cough: strengths and depths, timbre and tonality, and productivity. Clinical characteristics of cough. They can be dry or wet. Dry cough can be met in laryngitis, bronchitis, and pneumonia. Wet cough is more common in acute simple bronchitis, pneumonia, and whooping cough. Why should I adjust dry cough? Spread of infection inside the lungs, anatomical disorders, increased pressure in the pulmonary capillaries leads to effusion, may cause fainting, possibility of hemorrhage in the postoperative period, physical discomfort, vomiting, insomnia. When do I need to regulate my cough? When the cough is unproductive, dry, obsessive. In these cases, the cough loses its physiological expediency and not only does not contribute to the resolution of the pathological process in the respiratory system, but also leads to the development of complications. Productive cough. A productive cough is suppressed if it is obsessive, debilitating. In this case, symptomatic treatment with antitussive agents is used. Laryngitis in children. Inflammation of the laryngeal mucosa that causes false croup syndrome in children. Reasons: influenza viruses, adenovirus, respiratory syncytial virus, Pathophysiology, edema of the post-lining space, DP obstruction. Children under 3 years of age are more likely to get sick. Clinical symptoms, prodrome, runny nose, barking cough, feeling worse at night, inspiratory stridor, weakened breathing. Normal airways, swelling and narrowing below the level of the vocal cords. Patient management at home. Cool, moist air in the room, plentiful drinking, warm bath, soda inhalations, careful monitoring. If respiratory disorders worsen, hospitalization. All the other materials are available online. Thank you.